In our particular Healthy Heart program, we monitor all of our patients on a monthly basis, and our most recent data showed that we had 93% of our participants with improvements in one area or another. And for them to be able to do that is fantastic. And if we didn't have data, if we weren't collecting that, we wouldn't be able to know that. Data is important for our program because it enables us to be able to see how our patients are doing and how well we are doing with them to help them in their diabetes management. But not only is it important for us to see those numbers improve, it's also important for the patients. The data has also helped some of our patients be able to see that, okay, I've made it this far, I've improved my A1C, I've improved my weight, I've improved my blood pressure. So it inspires them to be able to take it a step further and say, okay, now what else can I do?
I'm proud of our program because our data shows that we are succeeding in all aspects, but I'm really proud of our participants because of the success they have shown. I mean, going from the counts to walking 5Ks to losing 7%, lowering their A1Cs, I mean, it shows that they're having a better life now than they were before. And they show this because they come to their appointments and they tell us every day that they're living a better life now.
Documenting your outcomes is really important. Documenting is taking all the measurements, blood values, cholesterol, blood sugar, and weight, and making sure that you're keeping track of those year to year so you can see if what you're doing is making a difference in the health of your patient. So I particularly like looking at the hemoglobin A1C in terms of documentation. I can take what the patient's hemoglobin A1C has been over the last 2 to 3 years and show that patient that all the hard work they have been doing has really benefited them in terms of lowering their blood sugar and lowering their risk for complication in the future.
Data can be a big monster, and it's a little bit scary for some people, but you can use your data to help your program move forward and not only identify your successes, but also your deficiencies. One thing that we do is we compare case managers as far as who has the best blood pressure control or who has the best A1Cs. When you do this, it shows one case manager may be a little deficient in one area and another case manager may be more of an expert. So you can have them teach up the other case manager so your program benefits both ways. Another great thing about data is it also provides provider buy-in. When the providers see that your patients are doing much better than the non-healthy heart patient, they're going to refer more patients into your program.
We give a report to our community members as to the diabetes program and the Healthy Heart program and what progress we're making towards those goals and objectives. And we use the data that we've gathered. But we've found out that community members do enjoy looking at some of that data. They like to compare their progress towards others. Like sometimes what we'll do is use the Healthy Heart, our Healthy Heart population versus our general diabetic population, so they can comparing themselves towards other community members. Then also we have them, sometimes we'll compare our program to another one in the nation so they can see how successful they've been as a group.